My name's Tammy. I am a consultant cardiologist by trade. We as clinicians and healthcare teams kind of think that we're the experts and consumers need to listen to us, but actually we need to start to listen to the voice of people with lived experience.
And so why do you think it's important to listen to lived experience?
I think it's very difficult to put yourself into the shoes of another person. There's something called projection bias, which means it's super difficult to make a decision about a situation that you aren't experiencing, even at the current time. And I think that's even harder if you've never even had any experience of what you're dealing to.
Kia ora, I'm Jodie. I work at Changing Minds. For us, codesign in the health sector is really important. It enables a provision of care that genuinely meets the needs of consumers, whānau and their communities.
Can you tell me what codesign looks like in real practice?
I think codesign in real practice is coming with an intention not to control, not to dictate, not to predict what the outcomes are going to be. It's about genuinely engaging with consumers, whānau and communities to find out where their needs are. What's Nelson Hospital doing to elevate the voice of its patients?
Well, I know that the dialysis unit was a massive step up in care for patients with renal impairment. Through COVID, we had to create a new facility, and that was essentially co-designed. They listened to voices of patients and whānau and created a much more light, airy space. The hospital had the idea to provide tablets or Wi-Fi, but after a co-design process and consultation with whānau, it was understood better that actually these patients are attached to machines, so actually can't use devices because they only have one hand. And so based upon that, they changed the model of delivery. They've got access to televisions, private audio. They can also have access to the space 24 hours a day. Without co-design, I think we would have delivered a facility that didn't quite meet the needs of patients, and often you can end up with something that doesn't work further on down the line and you're trying to unpick why, but it's that co-design at the start of the process that I think was so integral to delivering something that met the needs of patients and whānau, but also the staff.
That's such a good point. We talk about that all the time. Whenever I go and consult to anyone, I'm like, you have to involve lived experience at the start of the process, not bring them in further down the line as a tick box exercise.
Cookie colour spring.
Yeah, exactly. Yeah, so it's such an important point.